Hi friends, good evening once again. Welcome back to my channel Mookambika Nursing. Friends, in this video again we can see another set of questions from oncology, and we will see this important question one by one. The first question: increase in number of normal cells is called, and the options are option A hypertrophy, option B hyperplasia, option C dystrophy, option D dysplasia. Question is increase in number of normal cells is called option B hyperplasia is the correct answer. Hyperplasia means is the increase in number of normal cells, and hypertrophy means increase in the size of normal cells. That is the difference. Increase in the size means hypertrophy, and increase in the number of cells is hyperplasia. Here option B hyperplasia is the correct answer. Question number 2. A nurse is reviewing the laboratory result of a client diagnosed with multiple myeloma. Which would the nurse expect to note specifically in the disorder? And the options are option A increased calcium level, option B increased white blood cells, option C decreased blood urea nitrogen level, and option D decreased number of plasma cells in the bone marrow. Here question is nurse is checking the laboratory result of a patient with multiple myeloma. So the diagnosis is multiple myeloma, and the nurse specifically she should note which laboratory finding. That is the question. So here we have to know what is multiple myeloma. Multiple myeloma means is a malignant proliferation of plasma cells within the bone. It's a malignant proliferation of plasma cells within the bone, that is multiple myeloma. And in case of this multiple myeloma, there is a chance of increased number of plasma cells in the bone marrow, and anemia, hypercalcemia. Hypercalcemia means increased calcium level. That is the answer for this question. Option A is the correct answer. It will be noted in case of multiple myeloma. And also there is an increase blood urea nitrogen level will be in case of multiple myeloma will occur. Here in our decreased blood urea nitrogen is there, but it is increase in case of multiple myeloma. And also option D, there is decreased number of plasma cells in the bone marrow. There is an increased number of plasma cells in the proliferation. So increased number of plasma cells in the bone marrow, it is also wrong. And increased white blood cells. White blood cells may or may not be increased. Maybe it will be increased or it will be decreased. It will not affect the disease condition. Here the nurses should note the blood calcium level. Okay, so that will be increased. Among this option A increased calcium level is the correct answer. Okay, and the next question number 3, commonest spinal tumor is, and the options are option A meningioma, option B neurofibroma, option C neuroblastoma, option D myelomeningioma. Commonest spinal tumor is option B neurofibroma is the correct answer. Neurofibroma is the commonest spinal tumor. Question number 4, most common cancer in females in India is, and the options are option A breast cancer, option B uterine cancer, option C lung cancer, option D none of this. Here question is, it's an important question. Question is most common cancer in females in India, and the correct answer is option A breast cancer. If it is cervical cancer it is there, that is also correct. That is both breast cancer and cervical cancer is the leading cancer in India for females. Question number 5, World Cancer Day is, and the options are option A 4th February, option B 5th February, option C 8th February, option D 10th February. Question is World Cancer Day, and the correct answer is World Cancer Day is on 4th February. Option A is the correct answer, 4th February. Question number 6, common site of metastasis in colorectal cancer is, common site of metastasis in colorectal cancer is? And the options are option A bone, option B liver, option C lung, option D kidney. And the correct answer is option B, liver is the most common site of metastasis in colorectal cancer. Question number 7. A nurse is monitoring a client for signs and symptoms of superior vena cava syndrome. Which of the following is an early signs of this oncological emergency? And the options are option A cyanosis, option B arm edema, option C periorbital edema, option D mental status changes. Your question is nurse is caring for a client with superior vena cava syndrome. Only the signs and symptoms of superior vena cava syndrome, and among this which is the early signs of oncological emergency for that patient, that is the question. Here we have to know what is superior vena cava syndrome. Superior vena cava syndrome occurs when the superior vena cava is compressed or obstructed by tumor growth. Tumor is mainly tumor, that is lung cancer or lymphoma. So it is obstructed or compressed. It is means superior vena cava is obstructed or compressed. That time the signs and symptoms can occur. Early signs and symptoms mainly occurs in the morning and include edema of the face, that is known as periorbital edema, face especially around the eyes. Okay, that is the periorbital edema. Option C is the correct answer. And we can see the other signs and symptoms. Periorbital edema, and also client complaints of compression or edema of the hands and arms, that is their arm edema also there, but the early sign is periorbital edema, and next to that arm edema will come, and also mental status changes will come, and cyanosis will come, but the most probably and most important signs is periorbital edema, that is edema especially face and around the eyes. So here in this question option C is the correct answer. And the next question, question number 8. Question number 8. The nurse is reviewing the history of a client with bladder cancer. The nurse expects to note documentation of which most common symptom of this type of cancer. And the options are option A dysuria, option B hematuria, option C urgency on urination, option D frequency of micturition. Here the patient diagnosis is bladder cancer, and the nurse is reviewing the history of the patient and what documentation, the most common symptom of the patient she should document in the record, that is the question. So here we have to know what is the signs and symptoms of bladder cancer, then we can answer the question easily. The most common symptom of client with cancer of bladder is hematuria. So option B will come correct answer. We will see the what are the manifestations of this bladder cancer, that is gross or microscopic painless hematuria, frequency, urgency, dysuria, clot induced obstruction. All the manifestations of clinical manifestations of this bladder cancer. So first is main sign is or main symptom of this bladder cancer is hematuria. Option B is the correct answer. And the next question, question number 9. National Cancer Control Program was launched in India in the year. Options are option A 1975, option B 1985, option C 1977, option D 1979. National Cancer Control Program was launched in India in the year 1975. Option A is the correct answer. And the next question. Question number 10. Malignant tumor of the connective tissue is called. And the options are option A osteoma, option B sarcoma, option C melanoma, option D none of this. Malignant tumor of the connective tissue is known as option B sarcoma is the correct answer. Sarcoma is the malignant tumor of the connective tissue. This is the first set of questions. Again, next video we can see the next set of questions from oncological emergency, oncological nursing.